Ish. So, like most people that have exposure to reflexology took maybe that 2-hour iffy intro in school, and that was pretty much about it. Like the instructor held up the book or made you watch a DVD and basically told you that if you press various points on the feet, you might help somebody, and don't touch the ankles around pregnancy because that will induce labor. Like, that's it. That's pretty much about it. And I'm getting like a lot of nods. So everybody had that same experience, and I did too. Except about a year and a half into my practice, I blew out a shoulder because I was working too hard, and I needed to find something to do differently. So I threw myself into a reflexology class, and I didn't expect it to be the modality that I would practice for the next 8 years. So this is literally what brought me here now, is the art and science of manipulating the nerve endings on the extremities. And it's not just the feet that we're going to talk about today. So we're also going to be talking about hands, face, and ears. But before we get into too much about me or too much about the modality, what I would like to do is I would like to bring up a demo, yes, sure, my dear. And we'll do feet first, so shoes and socks off. I don't know.
I can get one out of my car.
I think we're good,
Okay.
if that's okay. I like it fast and dirty, Diane. So what we're going to be doing today is we're going to be talking about reflexology, but it's one thing for me to like talk at you about reflexology, and it's another thing for me to actually demonstrate what reflexology is, for you to see it and then ask questions as we're going, which I think will be a heck of a lot more fascinating for everybody in the room, and it will also keep my mind going because I love doing 50 things at once. So, as I get set up, does anybody have any reflexology questions that they are just dying to ask? Sure.
Can you do, like you say you have hands, ears, face, can you, one, take classes on any one of those and it benefit you?
Yes. So
Okay.
when clients come in to see me and they see the posters on the wall, the first question that they ask is, which one? Like, what do I do? Where do I go? I learned feet first, and that's kind of what I'm known for, so my clients are normally coming in for feet. But reflexologists know that we're focused on nerve endings, which holistically interconnect the entire body. So we're not focused on the extremity as much, so much as the actual technique of sending the nerve impulses through the body to get the body to rebalance what's broken. So I can, like, perfect example, I had a student of mine who hated the ear work. Like, she would not touch an ear to save her life. She's like, I love my ears getting worked on, Sam, but I can't. It's weird, it doesn't feel right. And so she had a back spasm in the middle of class, and I'm like, Kim, this is your moment. We're gonna use the ears to deactivate your back pain. And so we did, and we found the exact point that was actually hot, red, and inflamed on the exact same side that she was having the spasm, clamped it, and within 2 minutes it deactivated and the pain was gone. She's like, I will never badmouth the ears ever again. I'm not going to do them, but I'm not going to badmouth them. So that's how reflexology works, is it's not limited to one extremity. Instead, we're activating the nervous system, which is present throughout the entire body. It just so happens that these are our 4 windows into the house. Does that make sense?
So, like, I'm an esthetician, so learning the facial points would benefit me in my overall practice.
Totally. You could be seriously dangerous with some face reflexology during your consultation. Cool. If you wanted to come around and like get...
Can I do that? I didn't want to like interrupt during that
How are you doing, my dear?
question.
I have a sore on the bone.
Yeah, I see that. When did that pop up?
I don't want to walk on it.
When did that pop up? Sorry. A couple days ago?
Yeah.
We can talk about that if we have time.
It's not, it doesn't feel muscular, it feels like a sore bone.
It definitely, well, there is a little red spot on there too. Craziness. So, right off the bat, client says that they have a sore spot on the heel, which actually, like, there's a little red bump, so technically contraindicated for reflexology. I would not work that area, but I sure as hell would work around it. because I'm a dangerous reflexologist. But when we look at why reflexology is used and why it's not used, one of the reasons why I didn't pursue reflexology originally was because I got work done by a reflexologist that hurt me and used excessive pressure and really overloaded my nervous system, and that was a terrible experience. So first thing that I tell my students is avoid pain at all costs. Pain is not the body's friend, it's the body's warning system. So if we are going to stimulate the most sensitive periphery nerves in the body, the last thing that we would want to do is walk over an area that is painful, damaged, or exposed. Yeah, because that's just going to make the nervous system jump. And we don't want that. We want to relax the client. We want to stimulate the nerve endings without them kicking us in the face, preferably. Yeah.
I had an experience at convention and someone was working on my feet, and I told him if he didn't lighten up, I was going to kick him in the face.
Yeah, totally.
Yeah, because my feet were tender, and he was working on me in front of a bunch of people, a bunch of Allergies. I said, if you don't lighten up, I'm going to kick you. I don't care.
Yeah. There are actually a couple places that popped up over the past like 3 years or so that are claiming to do reflexology, and they're my best source of business because I get clients from them all the time, and they literally say they don't speak English and they hurt me. I'm like, that's because they're not doing reflexology, they're doing foot massage. Yeah, which is totally fine, 100%. But when you override the body's pain system, it shuts you out, and it's no longer going to absorb the work, right? So what you can see right now is we're using an alternating pressure. We're walking up what would be the spinal reflexes. You doing okay? Mm-hmm. Yeah.
Watching?
Just watching. Relax, client, relax. And this is how reflexology is traditionally performed. Certain schools will use like Thai massage, Thai reflexology will use like a stick. Also painful, no bueno. From that standpoint, like if you've ever received that type of work, it can be very sharp and very invasive, but their methodology is also different. They are trying to push the energy through the channels, yes. In Western reflexology, we are trying to stimulate the nerve endings to bring an endorphin rush, but also to get the nervous system to let go of any pain patterns. Our intention is different. And because of that, we don't need to force the body into a state of wellness that it's not ready to receive. That was some power. Somebody write that down. That was good.
That was good. We got it on Facebook. Right?
Yeah, we got it on Facebook. There you go. Technology, see? I'm trying to do that more because my students are always like, say that again. I'm like, I don't know what I said. So what we are going to do throughout the various extremities, and we'll have the other demos come up as well, is we're clearing the zones. So each section of the foot represents a different area of the body. The toes, where I'm at now, represent the head space and the neck space. So whenever somebody has sensitivity or damage to the toes, it always represents that issue. Like if you've seen those people with the feet that start to claw and the toes start to grip, that's all upper cervical. Yeah. Then we go into the ball of the foot. The ball of the foot represents the chest, lung, shoulder, heart area. Then the arch, we divide into proximal and distal. The distal arch, which is further away from the body, represents everything upper GI. Then the proximal arch represents everything lower GI. The ankle also represents the pelvic structures, the reproductive area, and the dorsal lymph. And then the heel represents everything lower body. So literally, the human anatomy is superimposed over the feet. Nothing is left out. Yeah? The idea is that the part represents the whole. And by manipulating the part, we can then affect the whole through the natural sensitivity of the extremity. It's kind of like hacking the body, right? You're using the sensitivity that is natural in order to access the nervous system, which penetrates every other system. So it doesn't matter if it's a digestive organ or a muscle, we're asking it to rebalance and relax, right? Everybody with me so far?
Yeah.
We've got good stuff going on? Okay. Any other questions on that?
The place you work on is the same side of the body?
Yes, so it's right to right, left to left, which can get a little bit confusing if you've ever looked at a reflexology map and you're like, what do all these shapes mean? I don't get it. It literally follows physical anatomy. So if you've opened an anatomy book ever and you've like paid some serious attention, it should come easily. The liver falls to the right, and so it's on the right foot. The stomach falls to the left, and so it's on the left foot. The kidneys are halfway in between the upper and lower digestive system, more towards the back. The lower GI, you have ascending colon on the right side, half of transverse, descending colon on the left side. Right? Pretty simple. Nothing complicated. Okay. So any specific questions that are running around in your minds right now as I'm continuing to work and feeling for stuff?
So are you using what they say and what you see with
Yes.
the body? Like, are you doing body reading?
Ooh, that's a good question. So clients lie 100% of the time, like they do. Either consciously, like they're trying to fool you, or they don't want to admit it, or subconsciously, like they truly don't understand where their pain is coming from, right? And we've all had that client where they come in with a shoulder issue, but it's actually coming from a hip. Yeah. I have clients, the beautiful thing about reflexology is I don't need to limit it to muscles and joints. So I had a client come in today who was complaining of sciatica. And the first thing that I said was, you know, you have fluid pressure, like her ankles were swollen. The reason the sciatica isn't going away is because you're not moving enough to get the fluid off of the nerves, right? So, fun stuff. But that like blows the mind of most massage therapists because they're like, well, if it's not muscle and bone related, then how do we address it? How do we see it? How do we access it? And that's where the assessment comes in. So in addition to the manual technique, we use the reflexology map and the state of the reflexes therein to determine what's happening with the client to better advise them on things like lifestyle changes and or treatment protocol. Make sense?
So do you want to talk about how,
obviously what a client presents and what you're seeing here that just jump out at you?
She wants to know what I'm seeing. That was that. She's like, everybody else is important too, but tell me what's wrong with me.
well, I'm talking about doing it like anybody, you know.
Right.
Obviously, no, I have eye arches and that deals with intestinal.
Yeah. So,
Right.
great question in terms of like client intake. So a client comes in, they fill out a really simple health history form. I let them lie to me, and then I let the body tell me the story, right? During the session, their job is to totally pass out and relax. It is not my job to give them the play-by-play and extract them from their experience, right? So I want them to pass out. I want them to be snoring, sucking the paint off my walls, enjoying that bliss, like going as deep as they want to go. And then when we're back out at the front, we'll talk. And that's when I'll give my feedback. We'll have a dialogue back and forth, and we'll really get down to the bottom of why they came in. Make sense?
So the pressure on the feet at this time was what you just did with her. It's basically, I know you said not to hurt them, but is it just engaging relaxation, or?
It's a blend of stimulation and palpation. So
Okay.
for the average massage therapist, my pressure is considered light. It would probably be a 2 to 3 out of 10. And that's when I'm doing like the regular walk around, when I'm just palpating the reflexes and stimulating the nerves. However, when I find specific points, that goes out the window and I address the point as I see it, very much like you would a trigger point, except what most of you have been taught is to apply as much pressure as possible in order to deactivate pain. Like that's the simple way to do it. Block out the nerve that's causing the pain by just overloading it with stimulus. Totally valid, not my approach. So what I do is I listen for how the tissue responds to pressure. If it invites me in, then I go deeper. If it shuts me out, doesn't matter if it's a 1 out of 10 in pressure. If it is feather light and the tissue is resisting me, I'm not going deep. I'm just not. I have a contract between the body and myself. I don't care what the client says. Yeah. So as far as pressure goes, facial itch, excellent. So as far as pressure goes, I do lighter work until we find the active reflexes that need to be addressed, and then we use pressure according to what the body asks for.
Yeah,
That makes sense?
Want to argue that?
Yeah, all the time. Great example, I had a mother-son team come in to see me this afternoon, and the son has been in to see me multiple times before, and he's like, I'm used to deep tissue massages. He's a muscular 20-something, like, I get deep tissue massages. And I've gotten my feet worked on, but that's not reflexology. And the way that he described it to his mom that he had brought in, like, first timer, was if they go too deep, it doesn't feel the same. He couldn't really explain it, but if we're going too deep, then we're overriding the nervous system, and the body isn't registering benefit, it's registering threat. So that's the difference, is we are communicating with the body as opposed to forcing our way into the tissues. Yeah.
So
You don't like it?
may I just ask, you went on this one, was that because of what you saw on this one?
No, I just always start on the right.
Okay. Why is
Personal
that?
preference. If I started on the left, you would spontaneously combust. No, it's just personal preference. It really is. Sometimes I'll switch it up, but most of the time I start on the right. Go
But if
ahead.
you did see an important thing that was flaring,
My method
not right, maybe.
that's interesting. So if somebody came in and they had plantar fasciitis that was so tender that I couldn't touch it without pain, what I would probably do is I would wrap the foot and let it rest while I tricked the body into releasing pain through the other side. 9 times out of 10, fascinating, my clients will report the stimulus from the one side going to the other side as the body intelligently takes the session where it needs to be taken. So cool. They're like, why do I feel that on my other foot? Like, because the body is amazing. That's why. Go ahead, second part of the question. Right?
I know you teach classes.
Yeah.
And you teach reflexology. Do you have any kind of an abbreviated or introductory class, anything that's shorter than?
Yeah, so I teach a full certification program where my students study with me for once a month for 12 months for a year. So it's really extensive. I do intro classes all throughout the area though. If you are interested in reflexology, I do have my entire routine for all of the extremities up on YouTube for free that you can access right now. Another facial itch, same area. So we have a definite right shoulder issue that the body is working on. Fascinating. So as far as technique goes, I really want to make sure that I didn't get the best reflexology education, so I want to make sure that people have access to the things that I didn't have access to. So I put everything out there for people to play with. And then if you're like seriously, if it's jiving with you and you really enjoy it, then come take a class. Because I don't want you to waste your money learning something that you're eventually going to hate. Like, nobody wants that. I've wasted enough money on classes and bought enough stuff at the gift shops to last me a whole lifetime. So I'd rather that not happen. So take the free intro classes online and then take a class with me. Normally they're about a weekend. So I'll be doing a weekend at Cortiva School of Massage for just the feet. And that's going to be end of April timeframe. And that's $295, and you'll get 14 hands-on CEUs for that. So that'll be a fun class. And then for any of you who are a little bit more versed in the holistic arena, I'll be teaching at the Omega Institute up in New York in October.
Yeah, that's great. I saw that on Facebook.
That'll be so fun. I'm so excited. It's going to be a week-long immersion on foot reading, just the assessment. Oh, I'm so excited. It's going to be fun. So, questions?
Her feet are open like this.
Yes, they are.
Does that indicate anything particular to you besides because you have your map, you have what you feel?
Yeah.
Is that indicating anything that you would use in what you're doing?
Yeah. So as far as the way her feet are positioned, so we know just structurally, hypermobile hips. Yeah, everybody understands how I got there? Yeah, the hips are like blah, and so the feet are like blah, because the feet are connected. Yeah, okay, just making sure. Got a couple weird looks with that one.
So when you said, oh, the reflexes,
Yeah,
I'm feeling it right smack in my eyelids, but not in my shoulder.
Not in your shoulder.
Yeah, so you're saying shoulder because you were working on the shoulder area?
No, because that is the facial reflex for the right shoulder.
Okay, cool.
So what happens is during a session, back to the body reading, as the body starts to absorb the work and take it in, there are little things that I look for, like muscle twitches, the stomach gurgling, itching of the face, as well as breathing changes to let me know where the body has taken the work. And the fact that she itched and is currently feeling that area of the face has lit up. On the face map, that represents the right side of the chest and shoulder area. So her body, for some reason, is registering that area of the body as being more important than the rest. And so that would incorporate into my feedback, like, is there a latent shoulder issue? Has there ever been? Also, if we went to the mental emotional side, that indicates past emotions that are being released. So that's another aspect of the work, a deeper aspect of the work. So all of that becomes relevant, and it becomes so much more than just a foot massage. Yeah.
So does reflexology work in a series of treatments or individually? I mean, can you come in and get one treatment and
You
have
heal?
benefits?
That's a good, yeah, healed,
You're healed.
bam! So everybody has those handful of miracle cases where it's like the client couldn't walk when they came in and they could walk when they left, and like, yes, I've had those, and it's fabulous. Most of the time, the body was ready, and I was just the facilitator for that transaction. It could have happened to anybody else. So when clients come in to see me, I'll give them my canned speech, which is notice how you feel over the next couple days. Based on how you feel, book your next session accordingly. Which means if you felt great and you would like it to continue, then book sooner. If you feel like you never want to see me again, don't. Because I'm not here to say you need to come see me 3 times a week for 6 weeks in order to get you better, right? My theory is that based on what I see in the reflexes and based on just us giving the body time to decompress, if they listen to the recommendations that I give and it resonates with them and they go out and do their homework, they should get better on their own because they've started to listen to the body and work within the body's natural rhythms. Okay? Like, example, mother-son. Son had a left hip issue, which he forgot to mention, but I found out. And so I said, great thing for what I'm seeing in your hip would be pigeon pose, for those of you who have yoga background, really, really deep hip stretch, but he's muscular enough, he's fit enough to where it would be totally appropriate. Comes back in, he's like, I don't know, I still feel it. I'm like, did you do the stretch? It's like, no, I didn't do the stretch. I'm like, well, that's why. He comes in today, he's like, I tried that stretch, that works. I'm like, yes, it does. Yes, it does. Good boy. So that's the dynamic. Is the client willing to do the work? It's not up to me to press the button, fix the issue. Yeah.
So all the benefits are somatic?
It ranges across the entire spectrum. Actually, if you could hold it sideways, that way it,
Go ahead and do another direction.
yeah, that way. That way it'll like film wide, would be the
Okay,
best way to
great.
say it. Yeah. So the benefits aren't just somatic, but a lot of people come in for pain, like physical joint pain. Clients will report digestive issues decreasing, hormones balancing. One of my first clients ever came in and said, I'm coming in every week and my husband is paying for my sessions because I didn't bite his head off during my cycle this month. And I totally think that you did that. Well, sure, I'll take it. Also, the first American study published for reflexology was on the benefits of the female reproductive cycles and reflexology in the Journal of Gynecology and Obstetrics. So like really deep hormone work is really cool. Sleep patterns regulate. I've had clients that have tried to lose weight and they report by exam, I don't crave the bad stuff anymore. But I can't control how the body chooses to process the session. So I'm just asking the body, hey body, you remember that state when everything felt good? Yeah, let's go back to that. And sometimes the body's like, okay, and it fixes itself because the body is intelligent. But then other times there are things that are standing in the way of the client self-healing. And that's when we have the discussion of, am I part of that regimen? Do you need to go see a craniosacral therapist? Do you need to go see a regular therapist? You know, what is it that you are lacking in your kind of mind-body-spirit complex that the feet are talking about that we can really move the needle for you? And sometimes that comes in the form of a treatment, and sometimes it comes in the form of physical pain. More often, my clients come in with physical pain, and the pain is what brought them in the door, but the issue is deeper. Does that make sense?
Yeah.
Yeah. Cool. How are you feeling, my dear?
Good.
Good. I'm glad. Now that the endorphins are all rushing, it's time for you to get out.
Your sessions are...
No, it's okay. Feel free to like chill for 2 seconds. So anything specific that, besides the eye stuff, anything that you experienced while we were just walking the zones?
There was some movement in the intestines, the big ones, not the little ones.
The big ones. I love that.
And there was healed bone on
I think it just needed to refresh.
How about, was it soothing? Was it?
That's a good question.
Did it create any emotional changes within you, or no?
No, not necessarily. I felt like my body was meeting him and working with him and engaged. Definitely. Soothing? It was okay.
Relaxing? I mean,
No, it was really more an engagement, a communication
okay.
goes back and forth. Instead of him doing it to me, I'm like meeting him too.
so you could really feel your body responding to him.
Yeah, we were definitely
We're having a conversation.
symbiotic, yeah.
Awesome.
Like that, yeah, it was really nice.
Thank you.
Thank you.
Cool. Who wants to jump up for hands?
I do.
So thirsty. Okay. Somebody got that. Let me be a good massage therapist and use some hand sanitizer. I couldn't whip this out before because, man, you guys gobble up my hand sanitizer every single meeting. Okay. So go ahead and lay down, lay flat. If you'd like. We're just gonna do hands though, but yeah,
Right,
feel
but
free,
I
just
just
for
didn't want
comfort.
for somebody's table.
You donated this table. I signed the release. Either one. Totally fine. Okay. So, hand stuff. Let's talk about hand stuff. So, in terms of the hands, sorry, speaking of which, alcohol makes hands cold. So, in terms of the hands, the reason why I would choose the hands over the feet is if, and I totally get to say this because I'm so close to MacDill Air Force Base, if the feet are missing, yeah, which is awesome to work on, because it's literally like same benefit, even when the extremity isn't there. If somebody has a direct shoulder issue, carpal tunnel, brachial plexus stuff, I've worked on, one of my clients got thrown off her horse and broke her neck, and we used hand reflexology to rehabilitate her. The doctor didn't understand what she was doing because it healed so fast, and that was really, really awesome to like see that. To have her come in with a neck brace, like totally immobilized, and to have her be able to do like little ranges afterwards with no pain, that was legit impressive. So with reflexology of the hands, we're doing the exact same technique, just on a different surface. So the hands are shaped a little bit differently than the feet, but the theory is the same. Press, release, press, release, press, release. It's an alternating pressure. And so all we're doing is sending those nerve impulses up through the body, and these are the exact same techniques that you'll find on the internet. For me, on my channel, I can't speak towards those other shady reflexology sites, but if you've ever searched for reflexology videos on YouTube, you know what I mean. This is what we're doing. We're very much having a conversation with the body. It just so happens to be a manual conversation instead of a verbal conversation.
You sit for those?
No, I stand. If I wanted to, I could sit, which is totally okay. Reflexology as a modality is very versatile. I'm sitting all day. Like most of my clients come in for foot work, so when I get to do hands, I'm like, woo, I get to stand, you know. But totally, if you wanted to sit throughout all of the extremities, you could. Most of my clients, so right now I have 2 students that are in their 70s, and both of them are taking the reflexology course because it doesn't hurt their hands. Yeah. So this modality is meant to be easy, it's meant to be effortless, it's meant to be powerful, but also non-stressful on either party.
Are you doing anything besides pressing? Are you pulling one way or another?
A little bit, not too much.
You're following what it's doing?
Exactly.
Mhm.
So then when I find a spot that I want to clamp on, then I'll hold it and adjust. Like if we wanted to stop here, we could stop here. It's a nice little groove in there. And so we're just going to hold that and wait for the body to tell me, like I'm waiting for marching orders from the body. So the body wants to bend the proximal digit a little bit, so I'm going to bend the proximal digit. And then we're going to wait for a response. So we're going to wait for the stomach to gurgle, the face to itch, muscles to twitch. There's a nice little muscle twitch, and so we're done. That's
So
the process.
Are the tips the head?
Yes. So just like with the feet, so toes represent the head, fingers represent the head. Then the knuckles represent chest-lung area in the hands. The palmar surface represents upper digestive. Just above the wrist, kind of like the heel of the hand, represents lower digestive. The wrist itself represents the hip complex and reproductive. And then what would be the distal row of carpals represents zone 4, the lower digestive, and then the proximal row of carpals represent zone 5. A little bit difficult with the mapping there, but there's a visual aid on the table. Look at it while my hands are distracted.
I'm curious if you've seen anything in your practice now that people are getting lots of tattoos and piercings. Are you noticing anything about that?
That is a really good question. So the one-offs, not so much.
Right.
The multiple piercings, yes. So what I look for with piercings and tattoos is the body's response to the stimulus. So if the body repeatedly rejects a piercing, where that piercing is located is super significant. Like my second piercing, when I got it done, it was infected for about 4 months, and that's like right in the middle of the lower back, which I also have a corresponding mark on my foot, which represents lower back weakness on that side. So when I did it, like my body went bananas, and I didn't know what was happening, but looking back, now I do.
Right.
So if the body is rejecting a piercing, that's significant. If the body absorbs a tattoo, that's also significant, but most of the time it's one-offs.
Gotcha. Thank you.
You could also read into, like, did the body like eat a ring, like it won't let it go, or does the ring keep falling off?
Yeah, I was wondering about
Allergic reactions and stuff?
well, and how people choose
Yeah,
where
all
they wear
significant.
their rings.
All
and-
significant. We
Yeah.
talk about that so much in class.
Gotcha.
Yeah,
Gotcha. Thank you.
yeah. Jewelry is fun to play with.
Now, you had mentioned when you did the feet, like you were going up the spine. Where is that in the hand?
So it's actually where a lot of you are sore, like thumb, pad of thumb representing head space, then the proximal phalanx representing neck space, and then all along that first metacarpal is spine, ending at the wrist, which would be tailbone coccyx. So,
Oh, when a joint flares, they always like to throw that arthritis as being the cause.
So here's my thing with arthritis. Love you, medicine. Love you so much. Doctors, I love you so much. You definitely have your place. Stand back well and cover your ears while I say this. Arthritis is different for everybody. So when somebody comes in to see me and they're like, I have arthritis, what kind of arthritis? What does it feel like? What does it look like? Is the joint actually swollen? Or is it cold and deficient? Is it actually like true arthritis, meaning it is swollen, it is red, it is hot, it is painful? Or is it earthed over? Is it rigid? Is it calloused? Is it locked? You know, or is it hypermobile and it's all coming from the nervous system? Is it fluid-based? You know, what kind of arthritis do you have? And that's ooh, facial itch. So we have that part of the equation, and then once we determine what kind of arthritis, then we would look at the joint's location. Because in addition to horizontal zones, for those of you that have been following me on social media, you know that horizontal zones and the direct physical map of the body is only part of the equation. We also have vertical zones of influence, which give us a grid system to then properly map both physical influences and mental emotional influences to decode every point of pain that could possibly exist on any extremity at any time. It's a science. And it's scary. Like, it never gets old. Let's see, what would be one that I did the other day? Oh yeah, so I have a Facebook group. It's called the Foot Reading and Reflexology Online Community, also known as FROC. And the group, they'll post pictures, like these are reflexologists and body workers from all over the world. And they'll post pictures of clients and we'll talk about them, like visually, like what's present in the extremity. And we'll assess and we'll swap notes, and it's really fun. And so this one girl posts, she's over in the UK, I think she was from, and she posts and she's like, this is a woman that I've been working on for a really long time. What do you see? Because I'm running into some inconsistencies, and I think that her body isn't doing as well as, you know, it could be. And so her toes were totally gnarled, and the nail of both big toes had overgrown and become opaque. Yeah, like jaded. And so I was like, well, that's Alzheimer's dementia, you know, memory loss in a handbag. And she's like, how did you know that? I'm like, because the toes, in addition to representing the head and neck space, which would physically be warped because the toes had warped, also represents the screen of the mind and somebody's thoughts and opinions. So go the toes, so go the mental space. And so we go through that with every extremity. Every blemish on the face, every swollen knuckle on the hand, every weird bump that occurs in the ear, every infection of the ear, all significant. I know, you'll never look at your body the same way ever again. Okay. So that's that.
Can you self-treat yourself on this?
You totally can. It does not feel as good. Just saying. Ooh, wow. We got a lot of stuff happening on this side that wasn't happening on the other side. So as far as self-treatment goes, you totally can. And it is valid. I deactivated a lot of pain patterns that way. Right. But really, I mean, if you're feeling crappy, then I would suggest, like, the body is screaming, answer it. Like, go get work done. Instead of, you know, just doing stuff. Any other questions, comments, concerns? Yeah, go for it.
Do people usually have a reaction right after you treat them, or are there some people that have kind of a delayed reaction that will take maybe a few days, a week to have a response to it?
That is a great question. So the other day I had a client come in, she was scheduled to come in, and that morning she actually slipped and fell on her hip and came in like literally limping. And I said, this could go one of two ways. Either like you broke something and this is going to be the worst hour of your life because the reflexology will try to repair it during the session and it will bring all of that pain to the surface. and that's not pretty. Like, I've worked on people who have recently broken things, and the body tries to heal the break during the session, which can be very uncomfortable. But I said, if it's muscular, if it's muscle and nerve based, then we'll turn off the pain right away, because we'll distract the body, and the body will release that pain pattern. And she gets up and she's like, the pain is better. Like, I could barely hobble in, and the pain is gone. And she said, her words was, "This makes me curious," because this was like her second session ever. And so we really didn't have that kind of rapport yet. But then there are clients that I work on them and they feel the residual effects well after the work, like weeks afterwards. Their body is still going through stuff. And that's very much how I respond to the work, like speaking from personal experience. The session flows through the body and really chews on different areas for, in my opinion, like about 7 days after the session. I'll tell clients, you know, if this is your first, bless you, if this is your first time coming in and you've never had this work before and you're not like coming in for an acute situation, give it time to settle. Like, even though you enjoyed it, don't book with me tomorrow, you know, feel it, like experience what the work is trying to do, and then base your decision off that. Give it time to process. Yes. Go for it. Well, no, we have a response. What?
I was going to, you had mentioned one reason you would choose the hands over the feet. Well, in my case, and as you felt when you touched this hand, I have more issues going on in the hand. I don't really notice anything going on my feet. So would I come in and request hand reflexology versus? Okay.
Totally. As a reflexologist, I know that if I was to grab her ear, her face, or her feet, does not matter. Yeah.
Okay, so it doesn't really matter.
But if a client comes in and they're like, I have plantar fasciitis, and I'm like, I'm gonna work your face. They're gonna look at me funny. They just are, because that's clients who aren't familiar with the modality, they're not going to get that part. So it's about, okay, you have hand pain, let's work the hands, and knowing that everything is interconnected. Make sense?
So technically you could have done my feet and I would have gotten the same response.
Right.
My hands would feel better. Awesome.
I had one client who, she's a realtor, love her to death. She's a talker, you know those. And so throughout the entire session, she's just jabbering away, la la la, like therapeutically, not like she's venting. And so halfway through the session, she's like, huh. And I was like, what? What's going on? She's like, my elbow hurts. Like, what do you mean your elbow hurts? She's like it hurts. Like, I'm moving it, but it's not because of movement. Like, it's just, like it's turned on, like somebody flipped on the switch, and she's like, yeah. Like, that's the work. She's like, I don't like it. Like, it's okay. Don't worry about it. Just breathe. If it becomes uncomfortable, we can always stop the session and give you a break. But, you know, let the work on you. And so we're proceeding through the session, and then she's like, man. And I'm like, what's happening now? And she's like, well, it went from my elbow into my shoulder. I'm like, okay, that's good. That means that the body is tracing the pain back to the origin of the nerve plexus. I'm like, fabulous, this is great. And that was nice. And then afterwards, she's like, wow, I really feel it in my neck, and so on and so forth. Like, the pain literally started to make its way back. And she got up and she's like, yeah, I don't have that shoulder pain that I didn't tell you about. Yeah, okay. And that, like, and I wasn't pressing different reflexes, and I wasn't working on her shoulder pain. The body just took it there because it's intelligent like that. And if you know how to intelligently work with an intelligent system, you know, you're not trying to type code with a sledgehammer.
So what have you been feeling? You've obviously felt something very different on that side than this side, and you're commenting on what you're feeling on that side.
So we've got a lot of low back stuff on this side. And that's because her outside, her pinky finger, that whole area was red hot when I touched it. It's calmed down nicely. But then also from a physical standpoint, both middle fingers were very congested, in the neck. And that's why I don't like to give feedback mid-session, because it's like I've only touched certain parts of the extremity. So definitely neck stuff on this side as well. But both middle fingers on both hands were very, very tight and congested, indicating stomach, liver, upper digestive stuff. So kind of like food inflammatory issues would be the best way to say it. So that's part of the equation. Yeah.
So let's say someone were to be interested in a full year.
Yeah.
And in the process actually working on each other.
Yeah.
So you address every system there.
Totally. So during the training weekends, the way that it works is my students come in and we have 2 full days together, 9 to 5. During that 2 full days, you are both giving and receiving all 4 routines. So you are getting 2.5 hours worth of work every weekend, minimum. That's if they don't, have a revolt and start working on each other in the middle of class. But with that, it's so nice to do case studies that way. To be like, I have this going on, I have that going on, I have this particular stress, can we see it through the extremities? I have this particular pain, can we treat it through the extremities? It's so beautiful to actually have somebody that you know and somebody that you have a little bit of background with to, like, in a safe space, round table it, and to work with it live. So cool.
What if someone has an extra extremity?
I have not.
Or missing one, like missing 4 fingers instead of like missing a thumb.
Mm-hmm. Missing a thumb is easy, but it is significant. So we would definitely talk about that. But it wouldn't derail the technique at all. Like, I'd still work on the extremity. The only reasons why it won't work on the extremity is if something's broken, if something's open and oozing, or like the client doesn't want it. So I'll have clients come in and they'll say, Sam, everybody says to come see you for footwork, but I hate getting my feet being touched. I'm like, that's okay. We can choose another extremity, no problem. But missing a digit is nothing. That's small potatoes.
So you talked about that during the year course, all 4 systems are worked on each student.
Yeah.
How many sessions is that for your clients? Do you have 1 session per extremity?
That's a good question. So most of the time when clients come in to see me for first sessions, I recommend just starting with the feet, unless they have like a pain somewhere that they would like addressed. The feet, I'll do an hour, hour and a half on. The other extremities, I normally like to pair in 2s. So somebody will come in for hands and feet, or face and ears, or ears and hands, or a half hour on a single extremity. But that is not the feet.
So 2 to 3 sessions.
But
to cover all 4.
But it's not like you need to cover all 4.
Oh, okay.
Yeah.
I didn't get that.
Yeah, so it's like if a client comes in and they're wondering which is best for me, esthetician work, she's just working on the face. She doesn't need to learn feet if she's not touching feet.
Got it.
If you don't want to work on feet, you don't need to learn feet. Yeah.
Thank you.
Oh, battery? Okay. Well, just let it die.
I have a portable charger.
Oh, cool. If we could plug that in sometime. Cool. And we're going.
Have a cord.
Survive. I'll let it die.
It's okay. If it dies, that's fine.
I'm gonna let it roll.
Yeah, let it roll. Right off that cliff. Okay.
When you're talking about 4 areas of address, basically each weekend training session, you're dividing 4 parts. Every weekend you're having each of the 4 parts addressed.
Yes. So each weekend we are working hands, face, feet, and ears within that weekend. The way that the weekends are divided is we focus on the system. So last weekend we did our reproductive system, and this weekend we're doing skeletal system. So we're specifically looking at when somebody comes in with knee pain, joint pain, etc. Like, what does that look like? How do we work with that? And do the extremities match up, and areas of emphasis and pathology? Like, we had 10 different pathologies and stuff like that. It's fabulous. Cool. How you feeling, my dear?
have a headache.
You have a headache. Good stuff. Describe the headache.
It's in the back of my head at the base.
Okay. Let's have you kind of rotate and stand back up and we'll see why that headache is there. Okay.
Did you get one before you started?
No, it actually came on while he was doing the work.
Yeah.
And I felt it, so you were talking about that shoulder, and I said, well, maybe it'll just move on out.
Yeah, could be. So what happens when a client feels worse upon leaving than they did when they come back in? Then, right? So that is damaging to credibility unless you know how to educate a client properly. So in this example, like doing a live example, if this client were to say, Sam, you suck, I'm leaving with a headache, what did you do to me? You broke me. You know, I would say, hold your horses for 2 seconds in that exact southern drawl way. And I would say we also found congestion in the upper digestive system, which means that the headache could have been brought on by a little bit of a detox response. Also, pain tends to be intensified when we have tried to numb it. So if they had taken anything for particular pain, or if they had recently gotten work done and the body hasn't adjusted properly, or if they've been like massaging some kind of topical onto it as well, that numbing effect would have been removed by the reflexology, which is trying to open things up instead of shut things down. So what we could have done is relax the tissues to the point where she actually feels where the issue is.
Okay, so now
Yes.
the headache's gone from there, and it's right here.
Yes, so it's traveling. Okay, so this is beautiful stuff. So this means that the session is continuing, right? So I have
So even though you're done, it's still...
the body's not done.
Okay.
So that's part of the discussion is normally when a client comes out and we're like this is when we would address this kind of stuff. We would make sure water is very, very important. In fact, I would definitely recommend you go grab a bottle right now if possible. And then, yes, assistant grabbing water. Oh, I love teaching at venues. But then also understanding like this is clearly where a lot of stuff is happening. So addressing that first and foremost,
Thank you.
yeah, is going to be the issue. Cool.
Thank you very
Thank you.
much.
Good stuff.
So how long would a session typically last if she had come into your office and had hand work done?
A half hour for just the hands. If she really wanted a lot of hand work, then I would do an hour. I would just do that same routine twice. Of course. We have one more extremity after this. How are we doing on time? Time check?
It's just after 8.
Yeah.
Just after
8:04.
Yes! We are doing so good. 2 extremities in an hour.
Can we take a 10-minute break?
No. Yes.
Okay, the reason I asked for a 10-minute break, I have minutes from last month's meeting.
6 and 1/2 dozen. I'm mobile. I can move.
Yeah, totally. Okay, everybody. So, we are going to resume with face, which, in my opinion, is probably the most beautiful extremity to work on. When I started branching out from the feet into the hands, like I was taught the hands, but the face and ear curriculum is actually mine. Like I made it because there was no face and ear reflexology accessible to me, so I had to wing it. And it just so happened that I was correct. So the face work, the more I did it and the more I practiced it, the more like the response that you get from touching somebody's face is the most outpouring of compassion. Like, it is truly beautiful work. So I encourage you, for those of you that have not taken some sort of face work class, like, let this be your excuse to delve into this extremity, because out of all of them, like, this is the one that really pulls on your heartstrings. Like, all of my students, they'll poo-poo the feet, they'll like, oh, the feet are difficult, or, yes, I'm talking to you. The ones watching this video, I know who you are, and they're like, oh, the feet are too complicated, or, you know, the hands are too easy, or the feet are too, or the ears are too weird, but everybody loves the face. It's just, it's the thing. So we're gonna be demoing face.
Should I have my
You're fine.
head on?
Just fine as is. So we're going to start just like the other extremities with just a little bit of relaxation techniques. So we're going to pump the shoulders, make sure the head is glued on straight, and then just massage masseter, temple, and forehead to release the major areas of tension. And that's it. And then we'll go into our walk. So super easy, super simple. Questions?
Do you have them pick up any earrings and stuff like that?
Good question in terms of like removing jewelry. If I'm going to be working the ears, yes. If not, then no. Like I'll work around most stuff.
Sam, what do you do if they got blemishes?
If they've got blemishes, great question. So it would be the same thing like if a foot was covered in warts or a hand was covered in warts. Any type of topical skin infection like is contraindication for work. Yes, we all know that from, basic massage school. So if somebody has a serious acne problem, chances are they also feel really self-conscious about their face. And so bringing attention to the extremity that they're already self-conscious about is inappropriate. So I would immediately discourage somebody who has like bad acne from getting face reflexology. Not because if they really wanted to, then I would totally go for it and do the best that I could with the areas that were not breaking out, but at the same time, just making sure that we choose the extremity that's most appropriate for the person. Yeah.
And as you pointed out, you'll get the same results with the other extremities. So
right.
You wanted to work on is that if that was ready to heal, it would heal wherever you were.
Exactly. Yeah. I have really great work with styes. That's always fun when somebody comes in with like an immediate infection of like one of the eyelash follicles. Like I'll reduce that to nothing in 2 seconds. That's fun. That's fun.
Is that a style?
No, I think that's a little bit too deep. Yeah. Allergies is difficult because allergies, again, it's like the arthritis question. You have allergies, but where are the allergies coming from? So when a client comes in and I'm like, allergies? Like allergies, where is it hitting you from that standpoint? So we will work the extremity, but a large portion of my work from that standpoint is asking the body, like, where are you broken? So is it coming from a deep-seated lung weakness? Is it a gut flora issue? Is it a true like sinus impingement? Is it a latent sinus infection? Is it due to the fact that they just don't want to go to work and their body is giving them the excuse not to go to work because the sinus attack? See that one a lot. So it's that type of question. And then based on what we see on the feet, we would then not only work a little bit more on that area, but also advise the client on like, look, this is where I think your allergies are coming from. Does that make sense to you? And we would have that consultation.
Sam,
Yes.
beards and facial.
Beards and facial hair. Oh my. I will work right through that bush. I do not care. As far as men go, like normally men don't come in for bodywork treatments because they're men. The men that I see are normally the wives, the husbands of the wives that I see. So as far as like men coming in with full facial hair, if they're coming in to get facial reflexology, most men will have the common sense to shave. I say most, but then like, bless his heart, John, thickest beard that I've ever seen. And he'll be there on the table. He's like, I want you to work on my jaw. Like, okay, John, we can do it together. But that goes back to, the contraindication aspect. There's a lot of things that I will work on that will make normal massage therapists cringe, and I'm okay with that. I will boldly go where no reflexologist has gone before. Totally went there. But at the same time, there is that line when we have to have the conversation in terms of this is inappropriate. We should do something different. And that line is clear.
What about TBIs and traumatic injuries, impacts to the head, recovery.
One of my longest standing clients, reflexology is her religion. She comes in to see me every single week, same time. She is a blessing on this earth. She had a traumatic brain injury, and she loves the work, absolutely loves it. From that standpoint. And besides like little cognitive things, like we need to make sure that during the session she feels comfortable, she feels safe, she's not experiencing any kind of emotional release, but at the same time, like that we can communicate, and that she doesn't feel like, you know, there's a barrier at all. It's all about appropriateness. So I've worked on dementia, Parkinson's, love those clients, absolutely. I have some pretty strong feelings about those diseases, but at the same time, it's the idea of, do they want the work? Is the work acceptable to them? And are there any blatant issues why we should not do the work? If not, then I'm going in. Yeah.
Okay, I'm gonna give you a little feedback on my hands.
Yes. What is occurring?
My hands feel different, but I'm also feeling like pain sensations moving through my hands. They're not staying in one spot. It's like, it's interesting because it was like in the palm, and then it went to the fingers, and then
Cool.
So I just thought I'd share that with you.
Yeah, so we opened up the nerve root, and now the body is starting to work out, which is so cool. But again, I mean, that's the exact same session that I would do on anybody. So it's not like I did anything different for her. I didn't hold a series of points that's magic that you won't be able to replicate. I asked the body to do what it does best, which is fix itself. Imagine that.
Question.
Yeah.
If you have a patient that had a major stroke, does this seem to work on helping them?
I have not had too much experience with stroke because I normally turn them away early stages. Post, totally. But if they're still covered in red tape, I won't touch them. And that means being actively supervised by a physician for complications. So
what about emotions with it?
100%.
Because my mother, she can't speak, so she's very emotional right now.
Yeah.
And the doctor knows they can't do any more for her.
Right.
But she's she cries all the time.
As long as they release her for body work, I would be happy to work with her. Emotions for me are a necessary part of the work, and I think that on some level, if you're a body worker, like you need to have versatility to be in that space with somebody, to hold that, and to be receptive to whatever comes up during a session. But on the flip side, like the goal isn't to make somebody bawl every time that they're on your table, right? So that would also be inappropriate. We want to make sure that what we're doing is helpful, but sometimes the help is not physical. So really just making sure that that's an active part of the conversation. During the certification program, we talk about that at length. Like it is a required part of the curriculum for my students to be able to have those experiences. You know?
What about neuropathy?
Neuropathy is another allergies situation. It's like, where's the neuropathy coming from? Is it an impingement? Is it a damage? Most of the times when somebody comes in with neuropathy, it's a fluid strangulation. And what I mean by fluid strangulation is their cardiovascular system is starting to fail, and their fluid is starting to back up in the feet, and that fluid pressure is strangling the nerves, causing them to scream and then go silent.
What do you think of fibromyalgia?
Fibromyalgia is a widespread cry for help. It's also the client's excuse to say no, which is a really like controversial statement for me to make, but at the same time, it is not fully psychological. Let me rephrase that. There is a definite physical imbalance that I see in fibromyalgia clients. It often has to do with digestion. It often has to do with hormones, and it often has to do with sleep cycles. However, there is the aspect where I've had enough clients that say, like in the middle of a flare-up, I need to come in for a session, and we get to talking about the context of the flare-up, and the context is always stress-related, always, 100%. They try to blame it on the beef that they ate, and they try to blame it on this and that, But I mean, really, when we get down to it, it's like, I'm seeing the joints react, but not to the degree that you're experiencing that pain. So we then take the exact same map and we start to look at the mental emotional component of things and start to say, well, if this was metaphorically oriented, head and neck becomes thoughts and opinions, chest and shoulders becomes feelings and emotions, upper digestive becomes career and actions, lower digestive becomes family and relationships, lower body becomes sense of security and how they're moving forward. So based on where your pain is and where the reflexes are showing discomfort, what is your stressor?
Oh, nice.
Yeah.
Did you write that down?
I did. It's all in the book.
That's great.
All right, I got the book.
100%.
Can't wait to go home and
Yeah.
read it.
Your charts, like the facial chart up
Yes.
there, are they for purchase?
Yes.
also?
So the charts, it's 30 for 2, 20 for 1, 20 for 1. So that would be 60 for the set if you wanted. I have all of them.
You have all of them with you?
Yes. And then the book is 15 for those of you that didn't get to hear that part.
So I was working on a client today,
I do, yes.
and I told her that I was coming to see you tonight, and I'm looking at your charts, and she was having sensitivity right in the right plantar chest lung area,
Mhm.
but it was radiating to the opposite side, to the left side.
Interesting.
Anything more besides interesting?
So describe to me again what the pain pattern was.
When I was pressing on the chest lung area of her right foot, it was radiating to the left side.
Okay, so let's talk about that. In reflexology school, I was taught that reflexology was press button, fix issue. I was taught that if somebody has a shoulder problem, you find the shoulder reflex and you mash that sucker as hard as you possibly can until the shoulder pain goes away. That was my training. I had enough clients start to disprove that I no longer teach that way. So when my clients report sensation in a different area, my default response is yes. So, Sam, I'm feeling that in my lower digestive system. Are you on those reflexes? Yes. I could be in the lungs. I really don't care. Because who am I to deny what they're feeling and where the body is taking the session? And again, I have no control over that. So if the body wants to take all of the work that I'm doing and put it into the reproductive area, then that's where the body has chosen to put it. But it's not as simple as press lung reflex, hit lung. It's about press reflex, stimulate balance, and then feel for what is happening in that reflex area through your touch. Does that make sense?
It makes sense, but she was very excited when I told her I was coming here tonight to see you, and then I would specifically ask about her situation. But of course, you don't have her history, and you don't have.
Well, let me tell you this. So you were in the chest lung space, in line with the second toe, or third toe.
Kind of in the middle.
Okay.
Right where it's showing in here.
Perfect. Excellent. So from that standpoint, you were on what would be the upper digestive and chest influence of the opposite side, which would be liver. She felt it in the stomach. That lets me know that she has acid reflux issues.
And so, considering I am not trained in reflexology,
Her body decided to take the impulse that was appropriate to the place that was appropriate, and it just so happened to be related to her upper digestive concerns.
so if I say to her, I talked to Sam about it, and this is the feedback he gave me, and that she's in an assisted living, so she's got nursing care, and you may want to talk to them about digestive issues.
Yeah,
Okay.
totally.
So that I can give her some kind of feedback.
Yeah, changing diet, working on water.
And she's definitely having issues with edema and not having any idea how to sort through it, and gaining weight, and I don't know how much of the gaining is from her diet versus water retention.
Exactly.
Lots of issues going on.
So my hands now feel fabulous.
And the saga continues.
Everything else had to.
Okay.
Is that it?
It was, I mean, from aching, because it went through a whole spell where it like ached and it moved all around my hands. to where now they just feel very light and no pain and just really wonderful.
Cool. Awesome.
Have you ever had a session go really wrong?
That is a
Somebody
good
ended up
question.
in the emergency room 6
No,
hours later?
never that. And also, like on the note of pregnancy, I have never induced a labor. I have tried. I have never induced a labor. And you are all good, my good sir.
No immaculate conception.
No immaculate conceptions. So what? Let's talk about that. So the body cannot be harmed by somebody that does not wish it harmed. From my like experience with reflexology. So if you're not trying to do something, the body knows what you're trying to do and will adjust accordingly. And especially in the case of pregnancy, it's this idea that if the baby's not ready and the body's not ready, then it's not going to happen. Same thing with physical pain. Even if the body brings up a soreness or a sensation, it's because it's appropriate. It's because it's working it out. It's because there's a reason for that. But it's never been the case where it's like, Sam, you hurt me, you know, without the body being in control the whole time.
So you did 3 different extremities.
Yes.
And did you do the same routine on all 3 of them?
Yes, so I cleared all the zones.
Okay.
Yeah, so I went from zone to zone and walked the various areas.
And that's all you did with me.
Yep.
That's amazing and pretty powerful.
It's magic. Okay, ears. Who wants to be ears?
I'm like deaf.
Okay.
Profoundly deaf.
Okay.
Can I thank
Yes.
you? Sure. Thank you. I need ears more than anybody else in this whole room.
There you go. She was waiting for this moment her entire life.
I was ready to jump when you said
Okay.
Sam, would you go over again about not hurting? And here's what's getting in my way.
Yes.
Is I have been hurt by massage therapists. I have felt like I was hit by a truck.
Yeah.
And it wasn't a good thing.
Right.
And it wasn't like, oh, I should feel this way. And so could you talk about that again?
So from a physical reflex standpoint, there are certain schools of reflexology that will emphasize pain is good.
Oh, yeah.
I am not one of those schools, and I am of the opinion that all body work should be that way. I know that there are bodies in this room that respond to that bone crushing pressure. I am not the therapist to deliver it. So when a client comes in to see me, I'm working with hypersensitive clients, I'm working with clients that have been hurt, and we are working in a very different way. The goal is not the sensation, the goal is balance. So it's not like you need to feel it for it to be working.
Got it. Thank you.
Yeah.
I wanted to make sure I understood what you said.
So lay down, head
Okay,
here
here.
or there, either one.
Okay.
You're fine.
I'm really like profoundly deaf
Okay.
and yeah,
Gotcha.
so I can't really.
Your job is just to totally relax.
Okay, yay.
Before you start,
Yes.
I just had a question. If you noticed anything,
I give you about a week. That was a joke. It's like half the room got. Clearly, it's past all of your bedtimes.
I thought that you always laugh on your videos. Wow, you sound like a Disney villain.
I love it. Oh, okay. As far as the face goes, the one thing that I notice is that the pelvic space isn't moving as much as it should. So there seems to be a little bit of congestion around the hips, but also like deep lymphatic pelvis. And that's what's causing a lot of the head stuff, is that the craniosacral balance is off. There's too much heaviness on one end and lightness on the other. Does that make sense? Okay.
So what I also noticed in his face after you did that, you actually look younger because I can see like how he really relaxed your
Put that
face.
on a brochure.
Especially in South Tampa.
Right? Seriously. Who needs a vampire facelift when you got Sam?
That's right.
Oh my god. So crazy.
Hey Sam, I had a question.
Yes.
Inflammatory arthritis such as adult Still's disease versus...
Such as what?
Adult Still's disease.
I'm unfamiliar with that.
In the rheumatoid.
Okay, gotcha. All right.
Versus psoriatic arthritis. One's more like joint pain, the other one is finger and toes.
It depends on where it manifests. So psoriatic arthritis, rheumatoid arthritis, any kind of arthritis. I've had clients where it manifests in their right wrist, and then sometimes it manifests in their left ankle, and then sometimes it's into their face, their jaw. So it just depends on like where it goes. But so I just did a webinar last weekend on reflexology and foot reading for head and neck pain. And we talked about this, about ditching the label of disease. Because one, as massage therapists, we should not be involved in medical diagnosis. That is not our purview. We also do not treat for medical diagnoses. So, like, I'm not working on whatever arthritis you have. I'm stimulating the body to balance, and that's my job, and that's where it ends. So from a physical standpoint, what I would look for would be the same in you as anybody else, which is there heat? Is there cold? Is there fluid retention? Is there dryness? Is there callousing, rigidity? What are the extremities telling me? Yeah. So it's not like there's a series of points for the arthritis family that I would hit that would magically decrease your pain. It would be case by case, which is really where the power is, because I'm not treating you like a disease. I'm treating you like a person, which separates us from the medical field, because compassion is not billable by insurance. So,
well put. The explanation that you just gave, do you go into that in the book? Is there more?
That is going to be book number 2, which I'm working on right now. The book number 1 is all about just the assessment and location of the reflexes. So the protocol is basically like, this is what this area represents. These are some of the cases that I've seen, and this is what it means from a physical and mental emotional aspect, versus like when somebody comes in with an infection of fire in the low back, this is how you would use methods of balancing and pointed work to either validate, invalidate, and work with that client. It's going to be one hell of a second book, but that's part of the equation.
So if you had somebody that you identified through your process of not only doing the work, but then the consultation with them afterwards, identified that it was more of an emotional issue, then what would you steer them towards as their next steps?
Different methods of balancing that would be focused in that direction. So sometimes it's seeking out professional help. I did a foot reading report for a gentleman in Ireland the other day, and in my methods of balancing, like recommendations, I said, now would be the time to seek out a counselor of some kind, because it seems like you're going through a lot. So that type of work can sometimes be necessary, and sometimes it's just about like, let's have you journal. Do you meditate? Like step 1, like, do you close your eyes and listen to what's there?
Would you do follow-up work in those? I hear what you're saying about a counselor, but let's say that you recommended journaling or meditating. Then would you be the person that would follow up with them on that, or would you steer them to somebody for that?
As far as accountability, like if they wanted an accountability partner, that's not my job. My job is to identify, to give feedback, and then to let them do the work. So that's kind of where I draw the line. And that way the client isn't looking at me towards like the source of their issue. Instead, it's like, either you did it or you didn't. And you'll know whether you did it or you didn't, because you'll either feel better or you won't.
Sam?
Yeah.
Do the quiet environment, no music?
I do have music. It's very like techno, not like techno, but like techno, not house music.
Happy hardcore.
When you say techno, I see people dancing and
right,
lights
no.
flashing.
What I'm trying to say is like it's technologically altered nature sound. So it's not like there's a bird chirping in the distance. It's like synthesizer. Yes, it's like genetically modified relaxation music. Yes, 100%.
528 hertz or something?
Kind of like that. So it's basically, it's just present enough for you to realize, oh, there's soothing music, but then it's just monotonous enough for you to be like, there's no more music. versus somebody playing the piano or like waves crashing or like whale sounds, which always freaks me out. I'm like, where'd the whale come from? Mine is more expensive because you're spending more time with me. So it's a $2,100 price tag, which we divide up into $175 each month. But you're learning a craft as opposed to taking a class. Yeah, so it just depends. Like, do you want the introduction from the originators of the modality? Do you want to take that and see if you like it? Or do you want to be with a group of people that are committed for a year to study something, talk about it, and also go deeper to the mental emotional aspect and explore the other extremities, you know?
And it's taught directly by you and not by
Correct.
disciples or
Right.
assistants.
It's all me.
Okay.
All me, all the time.
Thank you.
No problem. Thank you for asking such a beautiful question. Okay. What else?
I'm just curious how that feels to the participant.
How you feeling? Feeling? Good?
Good.
Good.
Oh, awesome.
Awesome. She loves it. So in terms of like extremity preference, that's a big one. So if somebody says, I love it when my face is touched, or like the way she responded with her ears, or some people are like that about feet, like in a non-creepy way. And so it's this idea that the body is saying, please touch me here, you know? So we always want to listen to that to say, you know, would it feel better if we chose another extremity because your body is more physically receptive in that space?
Makes sense.
It's a really nice way to put it too.
Yeah.
So like on me, my hands were screaming to be
Yeah.
touched.
Mm-hmm.
So I was glad I got the hands.
Yeah, totally.
But yeah, but they really were. I mean, it was amazing. And then it's amazing how they feel now.
Good, good. We'll see how it lasts.
I got a picture of this as live as it went.
Okay. It's recording. It's okay. Well, it will all be present on the internet in some way, shape, or form. What that shape or form will look like is to be seen. But if you guys are interested in reflexology, again, the best way to interact with me is through the YouTube channel, which has all of the techniques, which you can get for free and start playing. And then the second best way to interact with me is on Facebook. I have the group, which you can literally like scroll through and have hours of material of like looking at feet. We do the videos on YouTube are linked to the activity in the Facebook group. So I'll literally have people send me foot photos in the group and I'm like, this is a really great case study. Let's turn this into a case study. And so we turn it into a case study and we throw it up on YouTube, but that's all going on in the private group that nobody else can see. So if you join that group, then, you know, that's where I post a lot of stuff.
And to go about doing that, we visit your Facebook page, and then do you share about the group on your Facebook page?
Yeah. Mm-hmm. So it's a group that's linked to the Foot Whisperer Reflexology Institute.
About information?
Yes, it should be. Mm-hmm. Yeah. Yes. All of that. And then I'll be teaching a foot class, just a foot class at Cortiva in St. Pete, end of April.
That's where I went.
Yeah, Cortiva, I love them. Such a beautiful space to teach.
Have you seen the new?
Mm-hmm.
It's beautiful.
Yeah, love their new space. They're also going to be adding in aesthetics.
Mm-hmm.
So excited about that.
Do you have the exact date?
It's, I believe, the last weekend of April, fourth weekend. Whole weekend. You can take one day if you wanted. And then the week-long class in October, and then I'm doing, I think, another class in October for Cortiva, but that's foot reading, like just foot reading. And I'll probably post a lot more next year since it's a renewal year. I'll probably be at convention next year because it's a renewal year and all of that stuff.
The April course, do you have an idea how many CEs that one might be at Cortiva?
That will be 14.
14.
14 hands-on. So totally satisfies your 12 hands-on needed for renewal, plus 2 extra.
This counts as our hands-on too, even though we're not doing the hands-on, we're watching hands-on,
Yes.
right?
exactly. Yep. Okay. So let me just give you a little bit of tidbit as far as, because you can't really see it. So what just happened was I'm in her low back reflexes on the left side, and I hit this point, and the body's like, yay! And it literally just sucked me into this spot, which I am now holding because the body said so. And that's what a session consists of, is me going through the reflexes, using the alternating pressure, finding the points, and holding them until the body says, okay, you're free to go.
Is that holding, pushing, or squeezing?
Right now it's more of a squeeze, just because the ear's a little bit awkward that way. So my index finger is underneath providing the pressure, and then my thumb is backboarding it for leverage.
Now, since the ears are so thin, you don't use as much pressure on the ears as you do the feet, correct?
Mm-mm.
So you use less, yeah.
Yeah.
And I find that when I've done any ear work, some people love it, some people can't stand it.
Yeah. Same thing with all the extremities. So we would pay attention to that. And that's what I mean by contraindication. Like, it's not bad, but you wouldn't want somebody to sit through an hour where they were just terribly uncomfortable. You know?
Unless it was my ex-husband.
Yes. Unless it is a form of torture. And then...
And then you send them completely.
Yes, exactly. Exactly.
Actually, I like my
So when you work on the ear, do you ever work behind the ear?
Yes.
Okay.
Both surfaces.
So
with
you're working the back and the front, but how about like in this area interior?
not necessarily
Not
there. We
necessarily,
try to
okay.
stick on the extremities. It's like
Okay.
you might have seen me do a little bit of calf massage with the foot, but it's not like I'm into the calf, right? So we're doing the relaxation techniques, we're getting things warmed up, but that's not the focus of the work.
Okay, like on her, you did the or
Right,
on
exactly.
him, the
Mhm.
shoulders to relax
Yeah.
for the face. You're not necessarily doing neck work because that's all in
Right.
in with the.
No, you're good.
Like I am.
Cool. Awesome. Okay, we'll wrap up with this one and then we'll be good to go.
And do you think that there's a possibility that with what you're doing, it might help to improve the hearing? I would think so,
Could be.
because sometimes when I just lay down flat, it's like all of a sudden my ears pop open just from laying down flat on the surface.
What I'm noticing is that there's a lot of lower body impingement.
Or what?
Lower body impingement. So this idea that the upper body is compromised by the lower. So we want to have those discussions, and there are multiple markers that I'm seeing to confirm that. So we just want to have that discussion, like, you know, did you feel a difference during the session? You know, but then if you didn't feel a difference, here's maybe why. And can you work with stretches? Can you work with a structural therapist? Can you work with somebody else to align the foundation before we try to fix the roof again? Does that make sense?
Mm-hmm.
Yeah, right?
Moana.
Mm-hmm.
She's like, wasn't the prawn wherever it was the wind shifted the post.
Mm-hmm. Yes, exactly.
I have a 2-year-old.
Yeah.
So one of the things you mentioned with reflexology is it works with the nerves.
Yes.
Okay. And I know I have a lot of nerve issues going on,
Yeah.
especially in my hands and stuff. So I don't know, the real question that I'm trying to ask here is is it like releasing the nerves to be able to feel? Is it really, you know?
The best way to describe it is like when your hard drive has too much information on it and you need to defrag it to make space. Like you ask the computer to get rid of all extraneous things that are no longer serving the higher process.
Mm-hmm.
That is what I'm doing. Does that make sense?
Yes.
So it's like I'm asking the body, I'm telling the body like, hey, again, do you remember that state when nothing hurt? Like, let's try to get back to that if possible. And the body starts to, okay, and Rubik's Cube itself around to try to figure out, like, how can we get back to that space? Can we get back to that space? And all of the lighting up and the twitching and the gurgling, that's all the body trying to figure out, is there tension here? Is there tension here? Is there tension here? And move that out of the way so that wellness can pervade.
Almost like a
Yeah. Our initial state, our natural state is wellness. Yeah. So that's what we want to bring it back to. Hello, my dear. How you feeling? Oh, you're very, very welcome. Yeah.
Wow. Wow. That was amazing. The sensations I could feel, I was real surprised I could feel it in my psoas, and then my quads started jumping. And
again, lower body.
especially my left leg, which I have a lot of trouble with, and that was jumping a lot. But I was real surprised you got some popping in my ears, which is really, I usually only get that when I get sit in a sauna. Cool. Did I get that release, and you had it pop like 5 times like fireworks. I was like, whoa, this is like, to me that says it's inflammation and stuff coming down. I don't know if that's right, but intuitively that's what thank you. That was awesome.
Good, good. Awesome. So that was that. Yes, more time. So that's it. I'll stick around if you would like more info stuff and questions, but I'll let you guys wrap up with the meeting. And again, check for the video of all this when we post it.
Can you just say how